Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the subject of the broadcast is how to decrease risk of autism during pregnancy. And the focus is on uh, the concepts of stress and chemical exposures during pregnancy. And the deeper context is looking at all of this from a whole person health approach. And why that's important will be apparent in just a moment. This is just a brief overview of the larger topic. But recently I had a patient visit me who was expecting to have her baby delivered within the next 3 months. And she wanted to talk to me. She was a prospective patient as far as bringing her baby to me to provide care. And so she was interested in my attitude regarding childhood immunizations and some other issues that are hot button topics when it comes to risk of autism and other neurodevelopmental issues that happen in early childhood. So we had a good discussion about the different concepts that are floating out there about the possible role of different immunizations. And this is not the format to go into a lot of details of that, just to say that even though the medical community likes to paint this as a completely closed book, all the questions have been settled. I don't think it's quite that black and white. And so we talked about the shades of gray that exist in this whole issue and different strategies that one might consider when it comes to immunization of the baby during the early months of life after birth. But then we talked about the other issues that are within control of the mother, and that is that stress is turning out to be a major factor that happens during pregnancy that seems to be connected with an increased risk of autism. But there are also some genetic issues that we talked about, including the MTHFR gene or part of the gene that that is associated with some nutritional issues related to folate. So we talked about needing to have high quality folate in the diet in addition to the supplement, because the supplement has folic acid that mothers take during pregnancy, and folic acid is not biologically active. And in some people with this MTHFR problem, they have trouble converting folic acid to a biologically active form. So having good levels of folate in your diet is really a very proactive thing to do to decrease risk of any kind of developmental issues. We also talked about that autism isn't the only issue related to these environmental forces at work, and talked about how depression doesn't even show up until the teenage years, even though the risks and exposures to those risks happened early on during the early months of childhood or even in utero. And finally, we talked about glyphosate, which has another name which I won't mention here, but glyphosate is an herbicide that's used all over the place. It's used a lot on crops that people eat. It's also used in gardens to kill weeds and in people's yards to kill weeds. And how glyphosate may be playing a major role in risk of autism too. So the long and the short of it is, you want to have as clean an environment inside your body when you're pregnant as possible. Limit chemical exposures whenever possible. Eat in a way that is as close to organic as possible. And number two, you want to try to limit stress as much as you can and have strategies in place that help to mitigate the negative effects of stress. And again, that's the subject of a much longer video. These are overview concepts. But the point is that there are a lot of things that you can do that both improve your personal health and decrease risk of the baby having all sorts of different problems. And most likely the research in the future will show decreased risk of autism. We don't have proof of concept yet, but the evidence is definitely leaning in that direction. So I hope that you found this overview helpful, and that you're spurred to have as chemical-free pregnancy as possible. God bless you, and have a great day.